Part two of our special report inside a COVID ICU. Last night, we brought you stories of the doctors and nurses working through the surge of COVID hospitalizations. Tonight, Channel 5's Ismar Ventura shares a story of a couple who spent weeks battling the disease.
The Rangel family says that their days in the intensive care unit were agonizing. As time passed by, their conditions got worse. They say that they regret not getting the COVID-19 vaccine and have a message to the community.
To be honest, I was one of the people that didn't quite believe in it. I knew it was a virus, but I didn't think it was that bad of a virus.
For Luis and Minerva Rangel, living with coronavirus inside a hospital has been their worst nightmare. Minerva has been hospitalized for a month.
She was very close to getting intubated. By the grace of God, she's not, but I've seen her suffer a lot.
Luis says that although he overcame the illness, he wishes he could go back in time to get vaccinated, that maybe his wife Minerva would be at home with their family and not here, connected to a breathing machine.
We didn't get the vaccine because, there's rumors out there that you get side effects, and it was too soon for them to just release the vaccine.
Dr. Jose Luis Villalobos says that the pandemic continues because of those who have not been vaccinated. Among the most affected, people with pre-existing conditions.
The young people, below 30 and below, that unfortunately died. I think the main thread that I saw was, unfortunately, they were morbidly obese. And when you're intubated and, a machine's helping you breathe, on top of that, you're carrying all this extra weight. It puts too many pressures on the lungs.
Dr. Villalobos says that the coronavirus will continue mutating with more variants, such as the Delta, that is why it is so important to get vaccinated, and that because of this, there is a possibility that we may have to receive the COVID vaccine periodically. Matt Walduff is the executive director at Harlingen Medical Center. He emphasizes that although the world of science and medicine are more advanced now, the threat of our hospital systems collapsing is still a large concern.
What's complicating that, or I'd say exacerbating that maybe that vulnerability, is that a lot of our population who are chronically ill with conditions like diabetes or high blood pressure over the last 18 months have not taken care of themselves by regularly going to their physician or seeking care when they need it.
He says we have not reached herd immunity, that it's a false assumption.
We are all very busy as hospital organizations with catching up on caring for a lot of our chronically ill patients. And then if you added another surge from a resurgence of the pandemic, we would be certainly saturated and extremely challenged.
A spokesperson with the Harlingen Medical Center told us that Minerva is now at home with her family. Health experts say that everyone contributes to how fast we overcome the pandemic. And although in many places a mask is not required, they encourage continuing its use. Remember, vaccines are free and readily available throughout the valley for anyone 12 and older. Ismar Ventura, Channel 5 News.